Most people have heard of calcium oxalate stones, but did you know that there is a weak density subtype that is more likely to be broken apart, making them easier to pass and less reliant on surgery? If you're curious to learn more about this type of calcium oxalate kidney stone, stick around for this video. Hi, I'm Joey Weichman, and welcome to Stone Relief. Back when I was still going to the doctor for my kidney stones, not a single person ever mentioned to me that there were different types of stones and that some could be broken apart without surgery. And by without surgery, I don't mean by using a procedure like shockwave lithotripsy or some pharmaceutical drug. I mean they literally either break apart on their own or with the help of an herbal product. Learning this was an absolute game changer for me and completely revolutionized my approach to passing kidney stones. But this information is not easy to come by. As I mentioned, not a single doctor, urologist, or nurse ever mentioned anything like this to me at any point. I learned this by digging into the research like a madman, trying to figure out how to avoid surgery to pass 30 kidney stones that had accumulated between my two kidneys. So today, I will walk you through the 3 different variations of the calcium oxalate dihydrate subtype so that you can better recognize these stones and potentially change your approach like I did. So the first thing that we're going to talk about is just what this stone is in comparison to the other calcium oxalate stone that is in this family, which is the monohydrate stone. And if you have not checked out that video, I would highly encourage you to go check that out because it will set the foundation for a lot of what we're going to talk about in this video. All right, so as I had said, the previous video is going to help. So calcium oxalate dihydrate stones are less dense than their calcium oxalate monohydrate brother or sister. Now, the reason behind this is due to the water and calcium oxalate molecule ratio. So the way that this works is that the dihydrate stone type has 2 water molecules to every 1 calcium oxalate molecule. Now, this additional space between molecules, that ratio, makes these stones less dense. Whereas with a calcium oxalate monohydrate stone, it is a 1-to-1 ratio, and it is much more compact, and thus much more dense. So when it comes to this stone type, just like with the calcium oxalate monohydrate stones, it is all about diet. This is also known as secondary hyperoxaluria. It's the same exact thing. There's primary hyperoxaluria, which is a genetic malfunction that produces oxalate endogenously inside your system, primarily through your liver, whereas you have outside of the body sources or exogenous sources, which is what is doing with secondary hyperoxaluria. And that is all about diet. So some contributors to this particular type of stone. Now, there are several different things or configurations of these stones, as you'll see here. So if you recognize any of these are calcium oxalate dihydrate stones. So the biggest thing is going to be calcium, and that relates to really a couple different things. So in particular, it's calcium in elevated levels that differentiate the monohydrate subtype from the dihydrate subtype, other than the water relation, like the water molecule to the calcium oxalate molecule ratio. The calcium levels are what dictate this formation. This is the actual structure itself. This is what the stone is, but higher levels of calcium in the blood, also known as hypercalciuria, is what really drives calcium oxalate dihydrate stone formation. And aiding in this issue with calcium is vitamin D sensitivity, which we've covered in other videos. And then there's also possibility for some hyperparathyroidism, some hormone malfunction that also deals with the shuttling around of calcium throughout the body. Stay tuned for the next chapter where we'll dig in to talk about this first stone type, which is the calcium oxalate dihydrate type 2A stone. Okay, meet the calcium oxalate dihydrate type 2A stone. This is a stone type that is, I don't want to call it like near and dear to my heart because I absolutely hate kidney stones, but this is the type of kidney stone that I used to form. So I'm very, very familiar with this guy. So this particular stone type is the most common that you'll see when it comes to calcium oxalate dihydrate. Now, calcium oxalate monohydrate stones are the most common across the world, and calcium oxalate dihydrate are going to be less common than that. This is a little bit rare. Now, they're most notably recognized by their kind of like oblong shape. This is a poor example, but usually they're kind of like a longer type of shape, not necessarily perfectly spherical like you'd see with the calcium oxalate monohydrate type 1A stone, the most common type of monohydrate stone. So there's just a little bit of a different shape that goes to them. Now, this oval/oblong shape really has to go with how these stones form. And they typically butt up against the wall of the kidney, and they form along that flat surface, which is what allows them to have that a little bit longer type of crystallization structure, whereas the monohydrate type 1A stones more often than not will form on the tip of a renal papilla at Randall's plaque. And if you haven't checked out our video on Randall's plaque, I would definitely check out that video. Now, the most notable piece of this particular stone type is that they are spiky and they're sharp, and it's almost a little bit like barbed wire. When I passed my first stone, it was 9mm stone, and it was this kind of guy, and so it was 9mm in length and probably 5 to 7mm in like width itself, or diameter rather. And first impression I had, I looked at things, it looks like a barbed wire trap, and that is exactly what this is. And this can be a challenge to pass if you're not managing it appropriately, because again, these little barbed, spiky aspects get tripped up on the soft, fleshy tissue of your urinary tract really easily, and it was an entire nightmare to try to pass this if I hadn't created the product that I had created, which broke it apart, which made it way easier. Now, causes, just like the rest of these stones in this family, it's all about the diet choices that you're making, and in particular, as I'd mentioned previously, this stone really forms in the presence of elevated blood calcium or hypercalciuric states. So when calcium levels are normal, stone crystallization is mostly going to go down the monohydrate path, whereas when you've got more calcium, it goes down the dihydrate path and then thus changes the structure, as we talked about in the previous video, of the water to the calcium oxalate molecule ratio, which is what gives us the look and format and internal structure organization of this particular kidney stone type. Stay tuned for the next chapter where we'll talk about the second most common calcium oxalate dihydrate stone.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
All right, and welcome back. Meet the calcium oxalate dihydrate type 2B stone. So this particular stone type is the second most common type of dihydrate stone that is passed, and it is it's different in a couple different ways from that first stone, the most common type of dihydrate stone that we see. So this is going to be more round in shape, as you can see indicative here, and there's going to be some long and smooth crystals that go into building this thing, and it gives it its shape. It's almost like they've just kind of like the crystallization structure is kind of wrapped around its scent, and a lot of people in the research community compare this to like a desert rose. I don't see it. I don't really pay that close attention to botany, but nevertheless, that's kind of got like a desert rose type of configuration, as you can kind of see the swirling of these particular crystals. And just like with the other type of dihydrate stone, there's a lot of sharp edges here. A little less overall, but there's still some sharp and pointy edges here, which are characteristic of calcium oxalate dihydrate stones. Now, just like with the other one, the coloration of these are going to be light yellow to light brown. You're not going to see the dark pigmentations like you see in the monohydrate type of stone, and again, that is due to the water and calcium oxalate molecule structure ratio. There's more water in the dihydrate stones than there is the monohydrate, so they have a little bit lighter coloration to them. Now, just like with the other ones, it's all about diet, diet. Inappropriate oxalate consumption is what leads to this, but there are some other things that contribute to this particular stone's unique shape and formation versus that most common type. So just like before, increased calcium levels, hypercalciuria is going to be a contributing factor in addition to inappropriate oxalate consumption. That is what drives this stone type. But there's also a potential for low urinary citrate, also known as hypocitraturia. If you're curious to learn more about this, we have a video on that. Go check that out. And there's also potential for stasis or low diuresis. And what that means is that this stone is sitting in the kidney for longer periods of time than some of the other calcium oxalate monohydrate stone types. And this kind of gives itself to its unique crystalline structure and unique shape because, again, stasis, low diuresis, these are low urine volume environments where there's not much urine being passed. So the formation of these structures differ than someone who's passing urine on a normal basis. In the next chapter, we'll take a look at the last calcium oxalate dihydrate type that is a little bit more rare. Okay, let's meet the calcium oxalate dihydrate 2C still. And in the previous chapter I said it was a little bit more rare. I correct myself, it is a lot more rare. So this is not a very, very common stone. And it also is a pretty big departure from the rest of the dihydrate family. It's a little bit of the black sheep. Now, structurally, the dihydrates and the monohydrates, they can kind of share some forms, but this one's kind of like lumpy. It almost looks like a floretta cauliflower to me. That's like the best way that I can articulate the way that this thing looks. But the coloration is going to be different, and there's a reason for this. Unlike with these other stone types in the family that are kind of light yellow to light brown, these are going to be pale brown, but more oftenly they're going to be kind of like gray beige color like you observe here. Now, this stone type forms just like all the other calcium oxalate stone types because of diet choices that you're making. Inappropriate consuming oxalate, maybe you're not drinking enough water, but oxalate's the main driver. And then the contributors here, just like again the other stones, it's calcium. But what's giving this stone this unique shape and also the unique coloration is that it is forming in an environment where there's some form of malformative uropathy. And what this means is that there's some sort of an anatomical impediment, whether it be something that was developmental, you were born with it and grew into it, where there is not a free flow of urine from one of your kidneys or one of your ureters, somewhere along the urinary tract process that is going to be impeding the flow of urine. Now, this can sometimes be due to like a surgical error that someone nicked something that they shouldn't, and then there's an issue in scar tissue within the urinary tract, and this causes urine passage issues. But more often than not, it's some sort of a genetic malfunction that occurs in our development, which is not giving the urinary tract the shape that most other humans enjoy, which then causes a decrease in urine flow to a greater extent than stasis or low diuresis. It is just a very, very large struggle to pass urine out of here. And again, that gives this shape to the stone, the coloration as well, because it's not having as much urea pass over it. So this stone is super duper rare, but if you're seeing this type of stuff, there might be something else that is at play inside your urinary tract that you might want to have a discussion with your urologist about. Now, as I had mentioned, this stone type is near and dear to me. And if you recognize any of the stones that we've covered today, you are in a very unique position because this stone type is a weak stone type, and it can be broken apart not only naturally just through the velocity of the urine while you're trying to pass the stone and just normally urinating, but you can accelerate the speed at which your stone passes and eliminate any pain that you might be experiencing by checking out the product that I created to tackle the 30 kidney stones that were stuck between my two kidneys, in addition to that 9mm monster of a calcium oxalate dihydrate type 2A stone that I passed when I first got introduced to kidney stones. So if you're curious to see what our product can do for your calcium oxalate dihydrate stone, head on over to our website, stone-relief.com, click on the supplements link up at the top, order a bottle, and you'll be glad that you did.
Visit our website if you'd like to join a community of people learning to manage their kidney stones naturally. See you in the next video.